Hello, everyone. My name is Joe Conley, and I'm the founder and CEO of Visana Health. We're tackling the problem of chronic menstrual pain due to conditions like endometriosis, which is something my mother suffered from for 2.5 decades going undiagnosed. And despite the fact that it's more common in a working age population than diabetes and depression, women really struggle with this condition. They're told that the pain is all in their head, and they're called hysterical. And it costs $25 billion in healthcare expenditure every year, mainly driven by unnecessary and redundant surgeries. I've talked to women that have had 12, 15, 17 different surgeries for this condition. So this is kind of the state of affairs right now for women that have endometriosis. It takes them about 10 years to get diagnosed, and they're bouncing around the healthcare system getting different treatments. Visana helps by streamlining this care pathway by doing two different things. The first is giving the women a list of vetted physicians so they can self-refer and get the best practice care. The second thing we do is provide clinically validated self-management habits that are proven to reduce pain. This comes in the form of pelvic floor physical therapy, cognitive behavioral therapy, and diet changes to modulate your hormones. We're very aware that for this app to actually have a clinically meaningful impact, we need to drive behavior change. So our app is very much designed to actually drive that behavior change. And we're working with the Mayo Clinic right now to actually prove that our app will indeed reduce pain in a clinical trial. Our business model is based on the fact that our program is based on a landmark randomized controlled trial that showed that integrated care, so the components that I mentioned, has a cost savings of about $7,700 per patient. That's mainly driven by a reduction in surgical volume. We take that cost savings to our sales targets, who are self-insured employers and insurers, and they gave us a per patient payment. This is really important. Employers wanting to reduce their healthcare spend, and also with the Me Too movement, they want to benefit to show that they're a progressive company. Our team is built up of menstrual pain or chronic pain experts or menstrual pain patients, as well as 2 people from Red Brick Health who have built and scaled healthcare companies.
So your market is mostly to the insurers?
Right, exactly, through a reduction in spend. So the other big market is self-insured employers. So those are employers that are financially liable for the medical claims of their dependents. So it's almost every large company is self-insured now.
So I want to get this straight. It's the patient that is writing the checks, though, for this?
Nope, so the checks are written by the self-insured employers or insurance companies. It's provided to the patients for free.
So IP, is there any IP in the
No IP.
No IP, okay. What's your next steps?
So we're launching right now in a few different clinicians' offices, and we're also launching with our first employers. And then from there, we're kind of refining our program and making sure that we get good NPS scores and good engagements. And once we've proven those metrics, we'll hire our sales team and actually expand from there.
And have you priced out this product so that you know what the return on your investors' investment is going to be?
So we have priced out the product, and we've worked with employers to make sure that it's an acceptable level. In terms of the ROI, it would be difficult to say, but we obviously think it could scale up to tens or hundreds of millions of dollars. If you take the price that we're going at right now, it's about a $7.5 billion market.
And how much are you asking to get off the ground now?
So we have a friends and family round right now, and then once I get through those milestones, so through the launch and getting the NPS scores, then we'll probably be raising $750 to $1 million in a seed round, depending on how much the Mayo Clinic charges us.
This whole idea of kind of wellness-focused apps has been a kind of a trend with self-insured employers. But one of the issues has also been around compliant adherence to whatever that app is. How are you addressing that?
So I would say 2 things. The first thing I would say is that our patient population is really desperate, very sadly. But the other thing that we're doing is we've really broken it down and tried to make it very digestible. So we heard from a lot of patients that you can't just give me a bunch of information. So it's actually a 12-week program that they go through, and every week they get new material. We're also going to be integrating health coaches that ask what their goals are at the very beginning of the program, and then throughout the course of that 12 weeks, they hold them accountable. So they'll have a dashboard to say, why haven't you done your physical therapy this week? We're also using some modern psychological concepts, such as building up behaviors. So for example, with the pelvic floor physical therapy, you just start up doing 2 times a week for 8 minutes at a time, and it builds you up to 5 times a week, 15 minutes at a time, and it's really to drive that habit and drive that behavior change.